A resident recovering from surgery on Oahu becomes restless and pale while you assist them to the chair. What should you do first? A. Sit the resident down and call the nurse immediately. B. Give them water. C. Continue standing them up slowly. D. Leave to get another aide. Answer: A. Restlessness and pallor may signal low blood pressure or shock. The resident should be seated safely, and the nurse notified without delay. A CNA in a Hawaii long-term care facility must document care using A. Personal shorthand. B. Facility-approved medical terminology. C. Local language abbreviations. D. Verbal summaries. Answer: B. Only approved medical terminology ensures clarity and legal compliance in documentation. When a Hawaiian resident requests to pray before a procedure, the CNA should A. Proceed without interruption. B. Respectfully allow time for prayer. C. Discourage delays. D. Leave the room. Answer: B. Respecting spiritual beliefs aligns with culturally sensitive care and resident rights. When assisting a resident with a prosthetic leg, the CNA should first A. Force the limb in quickly. B. Check the skin for redness or irritation. C. Apply lotion to make fitting easier. D. Ignore if the resident resists. Answer: B. Inspecting the skin prevents pressure sores and identifies early signs of irritation. A resident on Kauai refuses breakfast every morning. The CNA should first A. Report the pattern to the nurse. B. Force-feed small portions. C. Ignore unless the nurse asks. D. Remove the tray quietly. Answer: A. Ongoing refusal of meals may indicate depression, illness, or swallowing difficulty that requires nurse evaluation. When transferring a resident to a wheelchair after bathing, which safety measure is essential? A. Place the wheelchair at a 45 degrees angle and lock the brakes. B. Keep the brakes unlocked. C. Stand the resident directly over the seat. D. Pull the resident by their arms. Answer: A. A 45 degrees angle and locked brakes promote safe transfer and reduce fall risk. What is the first step before measuring a resident's pulse? A. Record previous readings. B. Explain the procedure to the resident. C. Begin counting immediately. D. Hold their hand tightly. Answer: B. Explaining procedures builds trust and cooperation with the resident. When cleaning a resident's hearing aid, the CNA should A. Use alcohol wipes. B. Use a soft, dry cloth. C. Submerge in warm water. D. Spray disinfectant directly. Answer: B. Moisture can damage hearing aids. Dry cloth cleaning prevents malfunction. A resident's daughter insists on giving her mother extra medication. The CNA should A. Allow it quietly. B. Take the medication away. C. Inform the nurse immediately. D. Explain it's against facility rules and walk away. Answer: C. Only licensed staff can handle medication. Nurse notification prevents medication errors. During night rounds, a CNA finds a resident on the floor crying. The correct first action is to A. Check for injuries and call the nurse. B. Help them back into bed. C. Report in the morning. D. Leave to find assistance. Answer: A. Assessment for injuries and nurse notification ensure timely response to falls. When removing a soiled brief, gloves are required. What should the CNA do next after glove removal? A. Apply new gloves immediately. B. Wash hands thoroughly. C. Use sanitizer only. D. Skip if no contamination is seen. Answer: B. Handwashing removes microorganisms that gloves may not block completely. Which situation requires use of standard precautions? A. Only residents with infections. B. Every resident. C. Residents with cuts. D. Residents with rashes. Answer: B. Standard precautions apply to all residents to prevent the spread of infection. A resident with advanced arthritis asks for help opening utensils during meals. The CNA should A. Ignore to promote independence. B. Assist only as needed. C. Open everything for them immediately. D. Offer no help at all. Answer B. Encouraging independence while assisting when necessary promotes dignity and self-esteem. When making an occupied bed, the CNA should A. Raise the side rail on the unattended side. B. Leave both rails down for ease. C. Ask the resident to roll unsafely. D. Change linens without gloves. Answer A. Raising the unattended side rail prevents falls during repositioning. The CNA must report which of the following immediately? A. Resident complains of mild headache. B. Resident vomits blood. C. Resident refuses dessert. D. Resident forgets nurse's name. Answer B. Vomiting blood signals a serious medical emergency requiring immediate attention. When recording fluid intake, which item must be measured in milliliters? A. Ice cream. B. Soup. C. Coffee. D. All of the above. Answer D. All fluids, including semi-liquids, are measured in milliliters to ensure accurate intake documentation. To prevent aspiration in a resident with swallowing difficulties, the CNA should A. Allow fast eating. B. Sit the resident upright at 90 degrees. C. Offer liquids with every bite. D. Feed in a reclined position. Answer B. Upright positioning aids swallowing and prevents food from entering the airway. What is the most critical step in preventing infection spread in a Hawaii care facility? A. Mask wearing. B. Hand hygiene. C. Daily uniform changes. D. Sanitizing shoes. Answer B. Proper handwashing is the cornerstone of infection prevention. When collecting a stool specimen, the CNA should A. Mix urine with stool. B. Use a clean, dry container. C. Fill the container completely. D. Touch the sample. Answer B. A clean container prevents contamination and ensures accurate lab results. If a resident complains that their dentures don't fit, the CNA should A. Adjust them. B. Report to the nurse. C. Apply adhesive. D. Ignore unless pain develops. Answer B. Ill-fitting dentures can cause sores or difficulty eating and require evaluation by the nurse or dentist. The CNA must always report which change in resident behavior. A. New confusion or agitation. B. Increased appetite. C. Improved sleep. D. Regular toileting. Answer A. Sudden confusion may signal infection, medication effects, or stroke. When assisting with range of motion exercises, the CNA should A. Move joints quickly. B. Stop if the resident reports pain. C. Push beyond resistance. D. Skip the weaker side. Answer B. Pain signals possible injury, stopping prevents harm to joints or muscles. A CNA notices bruises in unusual places on a resident's arms. What must they do? A. Document privately. B. Report to the nurse immediately. C. Wait for family explanation. D. Ask other CNAs for opinions. Answer B. Unexplained bruises may indicate abuse and must be reported right away. A resident's call light should always be A. Placed within reach. B. Left hanging behind the bed. C. Removed during rest. D. Given only to alert residents. Answer A. Keeping the call light accessible ensures the resident's ability to request help promptly. When a resident begins to faint during ambulation, the CNA should A. Try to hold them upright. B. Ease them to the floor safely. C. Leave to get help. D. Pull on their arms. Answer B. Lowering the resident safely to the floor prevents head injury or fractures. When caring for a resident under contact precautions, the CNA should wear A. Gloves and gown. B. Only a mask. C. Shoe covers only. D. No protective equipment. Answer: A. Contact precautions require gloves and gowns to prevent pathogens spread via touch. If a resident expresses homesickness, the CNA should A. Change the topic. B. Offer to listen and provide comfort. C. Tell them to stop complaining. D. Call their family immediately. Answer: B. Emotional support helps reduce anxiety and promotes emotional well-being. Which action violates a resident's right to autonomy? A. Letting them choose their outfit. B. Forcing them to eat. C. Asking their preferences. D. Respecting their decisions. Answer: B. Forcing any action violates independence and personal choice. When measuring respirations, the CNA should A. Inform the resident you are counting. B. Pretend to check pulse. C. Ask them to breathe deeply. D. Start talking. Answer: B. Respiration should be counted discreetly to avoid altering the resident's breathing pattern. If a resident with diabetes does not finish their meal, the CNA should A. Offer extra dessert. B. Report to the nurse. C. Ignore it. D. Remove the tray silently. Answer: B. Missed meals can cause dangerous drops in blood sugar for diabetic residents.